Kia ora again, everyone. I'm Hamish Wilson, and I'm about to consult with Sophie Jones, who made an urgent appointment today to see us. She's a 26-year-old zoology tutor here, and apparently she had a turn or some sort of event last night when she was shaking and unable to respond to her husband, Michael. Usefully, Michael filmed that and sent it to us. Now, in the background, I saw her a few months ago when she suddenly became quite dizzy, which is probably viral vestibulitis at the time. She was seen again about that and referred for more tests, which showed she did not have benign paroxysmal postural vertigo, or BPPV. Now, this morning we looked at the video recording that Michael sent in. This looks very much like a dissociative attack or event. It does not look like an epileptic convulsion. We say this because the main features were that there was no limb shaking or tonic-clonic contractions or incontinence. She had back arching and side-to-side head shaking. Her eyes were tightly closed. She seemed to be sort of upset or tearful. Breathing was increased and her colour stayed okay throughout. And finally, the event lasted more than 5 minutes. And when she came to, she seemed okay rather than being drowsy or orientated. So this pattern is very distinctive for a dissociative event, also known as a non-epileptic seizure. The relevant sections in the handbook will be Chapter 7, the FND section, as well as the chapter on consultation skills. And the framework I will use is roughly along the lines of establish what the problems are for Sophie, listen to her perspective, within the usual differential diagnosis process, see if I can come up with an overall formulation based on the pattern of the story and the clinical exam. I'm going to offer her an explanation for what's going on and then provide some management suggestions and primary care while we wait for neurology review. Oh, kia ora, Sophie. Nice to see you again. And I'm sorry, I hear that you had a turn or something last night. Is that right?
Yeah. Had a moment last night where my husband ended up calling the ambulance.
Right. Well, that's pretty scary for you both.
Yeah.
And how are you feeling at the moment now?
I'm okay. I'm just a bit worried about.
Well, fair enough.
About it.
Now, Michael did send through the video, his cell phone video of that. I think we've had a good look at it, so I've got a pretty good idea what was going on last night.
Okay.
But maybe let's just start from the beginning. So I take it you're still tutoring this year, is that right?
Yeah.
And how's that going?
I haven't been sleeping really well recently, and I've been having some periods of dizziness.
Okay.
You know about those.
Yes, I know.
That have just meant I'm not really the top of my game recently with that, and so it's a bit draining.
Right. Okay. So there's quite a bit going on for you.
Yeah.
Yeah. Okay. Well, let's try and sort all that out, shall we? So let's go back to last night. Can you describe in a bit more detail what happened last night?
I kind of don't really remember it. It was kind of like an out of body experience. Like the whole world was spinning, but it wasn't really spinning. Like it just felt like it was spinning. And I remember that I felt it like terrified. I think I had my eyes shut, but I was crying and I couldn't move. My husband said he came and he found me, and I was only half responsive to him, and I had my eyes like squeezed shut.
Oh, that's terrible. And has this sort of thing happened to you before?
Actually, yes. I think something similar happened to me last weekend.
Okay, yeah.
But this time it went on so much longer than that time. That time it was like less than 10 seconds.
Right.
And at the time it freaked me out, but I didn't really think anything of it because it was just a really short period of time.
Oh, okay. And did you tell Michael about that?
I've told him now,
right.
But I didn't at the time because I was so freaked out by it.
That must have spooked Michael as well, I take it.
Yeah.
Yeah, to come into the room and find your partner can't respond to you.
Yeah.
Yeah. Was there any kind of sensation in your body before you had those two things, or what was going on inside?
Yeah, I did feel kind of strange actually, like my heart racing and kind of like sweating,
Right.
just suddenly sweating and that fast heartbeat.
You had the fast heart before it happened, and then you can't. Can you remember what actually happened during the kind of event last night?
Not really, just that I couldn't move and that I was terrified.
Right. Okay. Well, let's gather a bit more information, and I'll explain what I think's going on for you. And this is a known sort of an illness that people can get. So we can put your minds at rest that it's not a mystery. Now, just going back a bit, you did see, I understand you saw the specialist about your dizziness a while back.
Yeah, that's right.
Yeah.
Yeah, I saw a specialist, and they put me on a table and then tilted the table around.
Right.
And I haven't really had any like conclusive results from seeing the specialist.
Okay. And the dizziness is carrying on, is it?
Yeah, yeah.
What sort of, what's that like for you? Can you explain that?
It's kind of hard to explain. It kind of feels like everything is swaying, like I could be walking or standing still or even lying down and it'll feel like the room is swaying. And then really weird things like, for example, if I'm standing next to a bus and the bus is moving, then I feel like the bus is staying still and the rest of the world is moving, and like just really affected by like the movement of things around me, or even people like walking past. If they're walking past quite closely, I feel like almost pulled along with their movement, or like unbalanced by it.
Oh, wow. Okay. That sounds horrible. And you get that a few times. What, is it quite often? Or?
Yeah, it's quite often, but it's just really random.
It comes and goes.
Yeah.
Right. Okay. And when did all that start happening to you? Did it happen after? Because I saw you with what I thought was viral vestibulitis when you had a acute bout of dizziness. Did it happen after that?
Yeah, so that was the first time that I started feeling that dizziness. And that was really just like kind of normal dizziness, like feeling. And I was feeling nauseous at the time as well, like I was throwing up.
Yeah.
But then after that viral illness, I kept having this dizziness, like it didn't go away. I thought that it was just associated with the stomach bug, but
fair enough.
But
well, that's what you would think. Yeah, I agree with you. Okay, so something happened last night, and then you've had the dizziness for a while, and then when you came in, I noticed that your leg was a bit sort of draggy, or sort of dragged your leg a bit. Is that right?
Yeah.
What's going on with that?
I sprained my ankle about 2 months ago.
Right.
So, yeah.
Okay. And since then?
Well, since then I've kind of had a problem with my my leg on the leg that I sprained the ankle on. Right. Like at times it suddenly feels quite weak, and the only way to walk is kind of like dragging my leg, because it just feels like I don't have very much control over it. It feels very weak, and it's kind of strange. Sometimes it feels like it's easier to run than to walk.
Okay.
And that comes and goes like very periodically. Like sometimes, because I play tennis, sometimes I can play tennis completely fine, but then the weakness in my leg will come on like right before bed, for example.
Well, that's confusing.
Yeah.
Okay. Yeah. So if I add up all the timeline, 4 months for the dizziness, is that right?
Yeah.
And then 2 months for the left leg.
Yeah.
And then last night you had this thing happen, and a week ago you had the smaller event.
Yeah.
what else is happening in your life in the last, wee while?
I mean, like I mentioned, I haven't been sleeping that well. I've had trouble sleeping, just not great sleep quality overall, so I'm a bit tired and also a bit stressed because me and my partner have been wondering whether or not we should move to Christchurch because my sister was diagnosed with MS, multiple sclerosis.
Okay, I didn't know that, sorry, yeah.
Yeah, about 6 months ago. And so, now we're questioning whether or not we should join her in Christchurch.
Right, so that's quite a big deal.
Yeah.
And tell me about your sister. What's happening with her now?
She just spent a lot of time like going in and out of the hospital, and my parents have joined her in Christchurch to support her with that as well.
So that's a new diagnosis.
Yeah.
And is she, you're close with her?
Yeah.
Yeah,
very.
okay. So have you found any other sources of information on MS that you've been looking up?
I have seen I've been seeing videos of people with MS on TikTok, how their condition progressed and how often they end up being in a wheelchair.
Oh, okay. Well, that's no good. What does Michael think about you doing all that sort of stuff?
I mean, he's quite worried. He doesn't know. He doesn't have any idea, but he thinks that from what's been going on, it's the kind of thing that I need to get on top of.
Yeah. Okay, so let's just summarise. There's a lot going on for you then, Sophie. I guess this has been pretty frightening for you, really, with your sister being sick and now you're getting all these symptoms. Yeah, so what I want to do is try and sort of make sense of it all. The first thing I want to do is examine you, and just for the purposes of the video, I've taken your blood pressure and pulse, and you look quite fine. You look a little bit anxious, maybe. I've done a brief neurological examination, and everything is normal. What I do want to do now is a thing called a Hoover's test, and that tests that left leg of yours and see how that works. So we'll do that now. Is that okay?
Yes, that's
so. I'll show you what we're going to do. I'm just going to raise up your left leg. This is the leg that's not working so well.
Yeah.
And you're going to try and stop me.
Okay.
Okay, so here we go here. Yes, I'm raising up your left leg, and in fact I can raise your left leg, which is actually a bit unusual because most young people are pretty strong. And I'm going to keep my hand there. This time I want you to raise your right leg, raise it hard as you can against my hand, and when that happens, you probably notice that your left leg pressed down on the chair. Is that right?
Yeah. Mm-hmm.
Okay, so that's kind of odd, isn't it? That your left leg was weak and now it's a bit stronger again.
Yeah, that's really weird.
Okay, well, I've got some explanation for that. That is a positive sign, positive Hoover's sign. Now, Hoover's sign is a test you won't get in multiple sclerosis.
Mm-hmm.
It's a sign of a thing called functional neurological disorder. Mm-hmm. And just for the viewers, it's pretty uncommon to get a false positive Hoover's sign unless you had some problem with your hip, and you don't. As far as I know, you've got no problems with your hip. So to add all this up, Sophie, what you've got is at least 3 symptoms of functional neurological disorder, and that is the diagnosis.
Mm-hmm.
If someone was going to turn up with multiple sclerosis, I imagine your sister had quite different symptoms, it's turned out. I mean, a lot of people with multiple sclerosis start with problems in the eyesight, and you haven't had that. Is that right?
That's right, yeah.
No.
Mm.
And the sort of gait that you had when you came in, that's a dragging foot sort of a gait. That's not multiple sclerosis either.
Mm-hmm.
And the dizziness you describe as not multiple sclerosis. So I want to put your mind at rest. You don't seem to have multiple sclerosis at all.
Uh-huh.
But you do have this other disorder called functional neurological disorder, which you probably haven't heard of. Is that right?
Yeah. Yeah. So do you think that I have a psychological problem?
No, I don't think you. No, I don't think you have. I think you're correctly worried about your sister, and that's a big worry. And you did have the viral vestibulitis. And that's often a trigger for people getting what we call functional dizziness. And then the injury to your foot, that's often a trigger for some people getting what they call functional weakness of the leg.
Mm-hmm.
And then last night, you had what is known as a dissociative seizure. We looked at the video very carefully. I've already outlined the specific features of that dissociative event, where you're sort of spaced out and a bit sort of like not connected to the world. That sort of event is not like an epileptic convulsion at all. It's a different thing. This is called a non-epileptic seizure or dissociative seizure. And that's also not part of multiple sclerosis.
Mm-hmm. Okay.
So does that, I'll explain a bit more, but does that make sense to you in terms of your concerns about having MS?
Yeah, that's a weight off. I was quite concerned about that.
Yeah. I mean, for some people, when the unconscious part of the brain starts to make expectations about problems, well, they do. They start to get those problems. So it's a bit like, say, have you heard of randomized controlled trials, where they give some people a sugar tablet and some people the active tablet?
Yeah.
Well, some people with the sugar tablet actually get better, which is great.
Mm-hmm.
And some people with the sugar tablet actually get side effects like, headaches and stomach problems and dizziness, blah, blah, blah. And that's a sort of a negative expectation.
Right, yeah. So like placebo?
Yeah, like placebo, yeah. So my guess is that, well, you've got a lot of factors, a lot of triggering factors in your case. You've got concerns about your sister, concerns about yourself, and then a number of specific triggering factors that have led to these particular symptoms that you've got at the moment.
Mm-hmm.
But each of those symptoms, dizziness, the dissociative event, and the left leg weakness, each of those you can make a diagnosis of functional neurological disorder, and collectively it's a very strong picture for that, which is a nuisance because it's an illness and it takes some recovering from. And at the moment it's really affecting your life.
Yeah.
Would that be a fair summary?
Yeah.
Okay. So I'll just try and explain a bit more what's happening. So this is actually FND, or functional neurological disorders, quite well known now. For some reason it seems to be increasing in people. I don't know if that's where there's more people seeing things on social media or what, or they say at times of great societal stress, people get more of these things. It does happen. Or individual pressures, people can get those. So one analogy is, one way of describing it is it's a brain processing problem as opposed to a structural problem like MS or having a stroke or something. It's how the brain connects to the body. So they call it a software rather than a hardware, but so another way of looking at it, I mean, I've got a cell phone. I presume you've got a cell phone.
Yeah.
Sometimes my cell phone plays up and it won't turn off stuff.
Mm-hmm.
And so I have to turn it off and on. And then it's okay again. It sort of resets itself. But, I mean, if I opened up the back of it, all the wires and stuff would be in place. Mm-hmm. It's just that the wires aren't, for some reason, firing up properly and connecting together. So that's what's happening in your unconscious brain, a bit below our level of conscious control. It's down a bit. So sometimes this unconscious brain of ours can make a mistake, and if we have too much expectations about something, it then creates the very symptom that we're trying to avoid. So it can happen like that. Would that kind of make sense for you?
Yeah. That makes sense.
Yeah, sort of.
Yeah.
The good thing about this is it's actually recoverable, because once you understand how it works, then you can do things that can improve it.
Right.
So for leg weakness, for example, now we've noticed that the more you focus on the left leg, the weaker it gets. The more you focus on something else, it improves. The power comes back. So it's a funny sort of a trick of the mind. But what you can do when it starts to happen is maybe stop walking, but then juggle a ball between, a tennis ball or something between your hands. So you're really focusing on the juggling. And then as you start to walk, you'll find that while you're focusing on the juggling, your leg power improves.
Right.
Or else you could put music on or listen to a podcast and then go walking.
Mm-hmm.
And you've said that when you go running, that's fine, okay too. So that's a sign that the muscles and the nerves are fine. It's just that somehow the brain gets a bit confused and not coordinating properly.
Mm-hmm.
So that's quite recoverable. And what we'll do is try and find a physio person for you to help you with that.
Mm-hmm.
That's a really good thing to do. In terms of the dizziness and that dissociative event last night, I think the best explanation for that is probably something to do with our internal alarm system.
Mm-hmm.
So that's the fight, flight, freeze system that we have that alerts us to danger.
Mm-hmm.
The one, you've heard of that?
Yeah.
Sympathetic nervous system.
Mm-hmm.
It's there all the time, and it's very helpful because otherwise we wouldn't, you wouldn't cross the road. You'd hear the car coming towards you, and you'd stop immediately. So when that fires up, that sympathetic nervous system, it can do all sorts of things. Like you've probably heard phrases like trembling in fear, or frozen to the spot with fear, or fainting at the sight of blood, or those are what I'd call, or even panic attacks. Those are what I'd call uncoordinated alarm systems going off. So like a panic attack, a person's running around, they can't think, don't know what to do. It's very, very uncoordinated.
Mm-hmm.
Fainting at the sight of blood is really unhelpful if you're doing something and you faint. So and animals do this too. Sometimes you see, I saw a video just recently of two wolves fighting, and one wolf was clearly winning, and the other one went suddenly limp. And you think, well, that's over. But no, the other wolf, for some reason, doesn't bite it anymore, because that's a sort of a response by the losing wolf to go all limp, and that's a sort of a fainting thing. And then some animals in that sort of situation will shake as well. So it's called the autonomic cascade. It's quite a complicated title, but that sort of thing can explain why some people in certain situations can have these dissociative events. It's like your brain switching off. It's like, I suppose it's a bit like ostriches putting their heads in the sand or whatever, and then the clue to, in your case, that this was going on was the fact your heart was pounding and maybe you had a bit of a dry mouth or something like that before those two events. Is that right? Yeah.
Yeah.
So there was a big surge of adrenaline and the alarm system going on, and for some reason that sort of cascaded down into fainting and shaking.
Mm-hmm.
And that's out of your control. You didn't bring that on.
Okay.
So that's a sort of a potted explanation for the mechanism of a dissociative event or a brain processing disorder.
Yeah. Okay.
Okay. I imagine you've got a few questions about this.
Yeah. Just so the leg weakness, the dizziness, that's all connected?
It's all connected, yeah.
Right.
Yeah.
Yeah.
Well, it's part of each of those would be enough, but that's part of an overall thing. So my guess is that your internal alarm system or your nervous system is really fired up at the moment, and it's, not giving you enough rest, and it's hard to sleep and you feel tired and all that sort of stuff. I mean, technically, I suppose you might call that central sensitization. It's just the brain gets a bit sensitized and fired up, and then you get a lot of symptoms like that, and that's not so uncommon. People with chronic pain can get similar things like that.
Right, yeah.
Fibromyalgia and stuff like that. And it's well recognised, all the internal processes going on that create all these symptoms that on the surface don't make sense. That you'd have a leg that comes and goes, or dizziness that comes and goes. But when we understand the neuroscience now, we do understand this, and it's quite helpful for us to know all these things.
Yeah, yeah.
The important thing about that is it leads to what you can do, like with the listening to music while you're walking. And if you do feel a number of those dissociative events coming on, where you feel like it's going to happen again, the idea is to try and do grounding techniques. Have you heard of that?
I don't think so.
Well, that's just... Well, I'll go back a bit to... the sympathetic nervous system. I can find my little hand now, which I can't at the moment. I've lost it. Yes. Here we are. Now, this alarm system, I'll show you this picture. You can take this away with you. This alarm system, you've got the parasympathetic and the sympathetic, and they're supposed to be in balance, right?
Yeah.
At the moment, your alarm system is a bit fired up, but what balances it out is the parasympathetic. Now, this is a bit like driving a car. You've got an accelerator and a brake, but you can't do both at the same time. You're either accelerating or else you're slowing down. So what we want to do is try and increase your rest and digest system.
So does this kind of balance idea apply to everyone?
Oh, yeah, everybody. Everybody has this.
Yeah.
At the moment, I guess you could say your nervous system is a bit on high alert, and you're getting a bunch of symptoms, and they're contributing to it.
Right, yeah.
They're contributing, to the unconscious expectations that you have an illness, and those expectations are coming out in FND.
Right, yeah. I mean, what would contribute to me personally developing this? Because I mean, like, everyone gets stressed.
Yeah.
Like, why have I developed this over someone else who is also or more stressed than me in their daily life?
Well, it's a good question. Yeah. Well, I don't really know why you're predisposed to this sort of thing, but you have enough factors in your life that this sort of illness, the FND, is not so uncommon. You've got enough factors. Maybe there's some predisposing thing that we don't know about, but it's it's in the end. Some people have heart attacks. Some people have lung disease. I don't know why that is either.
Yeah, yeah.
I mean, some people. I mean, your sister's bad luck. She's got MS. We don't know why that is. You don't have MS. You have this other thing.
Yeah.
But I mean, sometimes people get into metaphors like this. So it must be so disorientating, I guess, that your sister's got this major disease, and maybe that's thrown you off balance, and that might be a metaphor for the dizziness. I don't know. There's a lot of people do get dizziness after you've had vestibular, problems like you had. So the why question is quite a hard question to answer.
Yeah, yeah. Okay.
But what we can do is work with you with the symptoms, and we can give you various things that will help.
Okay.
So you're probably wondering, how can I increase my rest and digest system?
Yeah.
Yeah, well, what I've got here, there's a very good website, a New Zealand website called FNDA, Aotearoa.nz, and that's got a lot of things on grounding techniques. There's a whole list of them here, and that's what I want you to be doing. Like the breathing exercises, the progressive muscle relaxation exercises, visualization exercises, mindfulness. Do you ever do mindfulness training?
No.
Probably heard of it, have you?
Maybe.
Yeah.
Mindfulness, maybe.
Yeah. I mean, mindfulness training is derived from the Eastern traditions, but it's mindfulness-based stress reduction sort of stuff, and that's just a way of slowing the body down and trying to develop the parasympathetic innovation going on.
Mm-hmm.
And that counteracts your alarm system that's fired up at the moment.
Right, yeah.
At the moment, you're still working and things, and you're kind of boxing on. Is that right?
Yeah.
Yeah. I mean, if you broke your leg, what would you do? You'd take time off?
Yeah.
You wouldn't have much choice, would you?
No, you'd have to.
Well, I mean, I maybe I'm just putting an option to you that, look, you've got quite a disabling illness at the moment. It might be quite worthwhile having a bit of a break, focusing on trying to understand what's happening, getting into all the grounding techniques, trying to down-regulate sympathetic nervous system. Would that make sense?
Yeah.
I do have some handouts as well. I want you to do quite a bit of reading, actually, because there's a very good website in the UK called, I don't know what it's called now, neurosymptoms.org, by one of the top neurologists in the world, and he's got a handout for every one of these symptoms, and I'm going to give these to you. Mm-hmm. There's one on dizziness, there's one on dissociative seizures, and there's one on functional limb weakness, and that's kind of homework, because as I say, the more you understand all this, the better chance you have of grasping how you can try and prevent these things happening and how you can improve.
Yeah.
So I'm going to give you those. I realise there's quite a bit of homework. I'm going to give you those as well. And there's the grounding list of grounding techniques. Mm-hmm. I mean, I often get people just to go onto the websites and look up, tummy breathing or diaphragmatic breathing, look up gratitude meditations, going for walks in the forest, taking your shoes off and grounding your toes in the dirt, mm-hmm. having time for yourself, and especially in your case, stopping any worrying that you've got MS.
Yeah. Yeah.
And also, maybe talking to Michael about this and explaining it all to him, and
mm-hmm.
that makes sense.
Yeah. And so all these techniques, they help.
Definitely. Yeah, definitely help. People recover from this.
Yep.
I mean, your sister will probably, I'm not sure how she's going to go with her MS, and there's very good medications for that now. Mm-hmm. This is not a situation where medication helps. This is a situation where you need to learn about it and try some things, have a bit of time off maybe, get your head around it, and I'd expect you to recover and not have any more of those seizures with any luck.
Mm-hmm.
And what I want to do is see you again in another week. Mm-hmm. I will refer you off to neurology for a review, because this is a major illness and you need to have the best advice on that.
Yeah.
And also I'm going to find someone who's local in this area to give you some help with the physiotherapy. Mm-hmm. It has to be specific physio, FND physio, rather than just general physio, because it's a different kind of approach of distraction rather than focusing on the leg that's not working.
Right, okay.
So there's local people here we can get in touch with and ask them who can make an appointment for you, and you can get engaged with that, and that will be helpful as well. So we need to pull out all the stops at the moment, Sophie, for you to get better.
Okay.
Is anything else I've missed or you want to talk about?
No, I don't think so. I think that's something that I know that is probably lacking in my life, like grounding techniques and things like that.
You've been pretty go.
Yeah.
And boxing on and stuff like that.
Yeah.
Yeah. I mean, you're a person who likes to kind of push through.
Yeah, and I mean, I thought that's what would help, or that I'd eventually just kind of get back on track if I just kept living my usual life, but it hasn't happened.
Yeah, well, what we talk about with persistent pain is similar to that, but it's not a good idea to box on through, because that just trains the brain really to associate those activities with creating more pain. In your situation, you need to do stuff up to the point where it causes symptoms, but below that. You need to keep well below that. And gradually, after a while, as you do more, the brain realizes it doesn't have to create those symptoms. It's a bit complicated.
Yeah.
But and there will be times when, you have a bad patch. But there's an interesting little diagram here. That one there, if you have a look at that, that's symptoms getting better over time. But you will have bad patches, they come and go, but not to worry about a bad patch. The overall trajectory will be positive. Right? See, so what I call it is awfulizing. If someone has a recurrence of their symptoms and they awfulize and they'll never get better and stuff like that. Well, if the overall trajectory is going up and you're gradually getting better, then having a bit of a bad patch is not to be unexpected, and just live with that and carry on through. Not to worry too much about it.
Yeah, and in this case, would actually kind of having that moment of, I'm never going to get better, would that actually contribute to more stress? And then
it can do, yeah. That sort of negative emotion is not helpful.
Yeah.
So the idea is to notice that you have a negative emotion like that, a sort of feeling of hopelessness, I'll never get better, and then notice it, but not actually believe it. Very important, that's that point.
Yeah. Okay.
Okay, so should we leave it at there and maybe see you next week?
Yeah, that sounds good. Thanks very much. I think that the consultation was very helpful because it kind of finally gave me a diagnosis on a lot of symptoms that I was worrying about and that I had no idea were connected. So yeah, it feels really helpful to finally be able to put a name like FND on what's been happening to me, and kind of realize the differences between FND and MS, and something that's more serious or something that needs medication versus FND, which I was told is about kind of learning to regulate your nervous system, and that things that I've been doing in my life or not doing, which have not been very helpful in kind of controlling my symptoms. And the advice that I received on what to do next was also very useful, I think, very thorough. And so I think I have a good idea of what is going on and also what to do next.
Okay, so now I want to review what happened in this consultation with Sophie. Well, firstly, I've done quite a bit of learning about FND in the last few years, so I was able to recognise those quite distinctive symptoms and the overall pattern of her presentation as being strongly suggestive for FND. For patients, these symptoms can be very disconcerting and frightening, so my initial task was to explore what it was like for Sophie, and then, given all the information, to make a positive diagnosis based on these specific clinical features. If we use the biopsychosocial formulation or framework, I was not sure about predisposing factors in this case, but she seemed to have clear triggering or precipitating factors for her symptoms, such as her concerns about multiple sclerosis in the family, the viral vestibulitis, the minor injury to her leg, and perhaps watching TikTok videos of people with turns, which increase her expectations of things going wrong. This combination of factors would be more than enough in susceptible people for FND to develop. Now, a possible perpetuating factor might have been the absence of a diagnosis that could have contained or held her anxieties, as without such a diagnosis, she has simply no way forward. My second role then was to provide a framework for what was happening, and in terms of what to do next, there is no magic bullet or tablet that she can take. It's usually more about encouraging Sophie to do some learning about FND so she understands what she can do to help reduce the symptoms. The ongoing task for us will be to stand alongside her and see if we can help her get through this very difficult patch in her life.